For our next panel, we're going to continue talking about the state of food policy in the U.S. Leading this conversation is freelance journalist Saba Rahimian. And joining her, we have Rick Whitted, the president and CEO of U.S. Hunger, Luis Guardia, the president of the Food Research and Action Center, also called FRAC, and Clayton Tucker, a rancher, the owner of RX Ranch, and co-founder of Killeen, sorry, I don't know if I pronounced that correctly, Killeen Creators Community Gardens. Please give them a huge round of applause.
All right, is this thing on? Not yet. Is this thing on? Hello, hello, hello? Can you hear me?
Yeah, I heard you.
Can you hear me? Yes? Okay. All right. Hi, everybody. Thank you. Thank you for joining today. My name is Saba Rahimian. I am a freelance journalist. Prior to writing about food, I made food in professional kitchens for 8 years. So this has been a big part of my life, and I'm really honored to be here with these three panelists. Deeper into the black hole of food policy. So each of them is working in directly understanding a lot of the data and the statistics and what's going into these policies that are being created, and they're helping provide insight. So I would like to turn it over for you guys. I would love for you to introduce, I will introduce you. We have Rick Whitted, who is the president and CEO of U.S. Hunger. And then next we have Luis Guardia, president of Food Research and Action Center. And then we've got Clayton Tucker, who is the owner and rancher at RX Ranch and co-founder of Killeen Creators of Community Gardens. So without further ado, I would love to let you all introduce yourselves and talk a little bit about your respective organizations and how you are coming to understand what policies we are currently working with and what some of those roadblocks are that we're coming up against that are actually propelling us back into pandemic era challenges of addressing hunger nationally.
Yeah, so I'm Rick Whitted with U.S. Hunger. We are a nonprofit who started in response to the Haiti earthquake of assembling food and getting it out across the country. A decade in and 150 million meals throughout this country and parts of the world, the pandemic occurred. I happened to become the CEO on March 2020 when all of that went away for almost 2 years, and we immediately turned to data and technology. We realized as a nonprofit, well, we didn't have a lot of that, but it was all we had, and we began connecting our systems and making them talk. It's funny when you do that and you've been working on hunger for more than a decade, it's amazing what starts to pop out. And so we have continued that process, and now since the pandemic of March 2020, we have surveyed more than 210,000 homes across the country, individual level surveys around health-related social needs and really understanding the root cause. As we got down that journey, it became really clear we needed to really, before we continued focusing on how do we get food to folks in situations of famine, that we first asked the question, why are they hungry in the first place? And so we have really transitioned, thank you, we've really transitioned our entire program around data through health-related screening to understand that very question. What is at the root cause? What are the upward pressures that are creating the downward result of hunger? Surprised, it's not food. It never starts at food. So,
thank you. Luis?
Great. Now I get the connection between the NASA people and this. It's the black hole policy. So that was so important. Much like what we've been hearing before, we've been focused a lot on similar issues. So again, I'm Luis Guardia, president of the Food Research and Action Center. We are the leading national advocacy and policy research organization focused on ending hunger at scale through the Federal Nutrition Program. So we do this in partnership with hundreds of state and local groups across the United States, some of them here in Texas and in every state in the country. We do that by advancing bold and equitable policy solutions to address poverty-related hunger. And so one of the things that we've been seeing, and Saba, you alluded this in the introduction, is unfortunately, we're back at pandemic level eras of hunger. Imagine that. We are back at those levels. A lot of things have contributed to that. Some of the things that you've been mentioning, we need to address the root causes, but certainly the end of some of the pandemic era benefits, as well as rising food prices. And one of the things that gives us a lot of concern is some of the things that we learned during COVID. We saw just how impactful these programs that you heard about even in the last panel, how impactful they can be to people's health and well-being. And we did a report about this. You can find it on our website, FRAC, FRAC.org. And it talks about the connection and what we saw between people's health, both physical and mental health during the pandemic, and how it was connected to and improved with some of the benefits people got. We saw people's stress and anxiety level go down. We know that hunger is related to so many diet-related diseases, high blood pressure, obesity, diabetes, the list goes on. So, and I think the other thing I would sort of tease out in some of the conversations that you've heard about is sort of, you heard about it with our, our friends from the White House in terms of the all-of-government approach. There's this all-of-community approach to hunger lives because we have some of the issues that we talked about in terms of what's driving people into poverty, but we also know how important it is to think about it from the aspect of climate, how important it is to think about it from the aspect of health, and from community empowerment and economic mobility. It's all really connected.
Thank you.
So first, let me thank y'all for being here and inviting me to speak. And also, most important, I want to thank each of y'all for being here. Food policy is so important, and I'm really, really glad to see y'all taking an interest. So thank you. So I come with a little bit of a unique perspective because I am both a producer and an organizer. It is a fun combo. So we have the ranch. It's a family ranch. I'm the third generation at it. We raise cattle, and now we're diversifying into goats because the climate is changing, and goats are a little bit better for arid climates. I am also a political organizer, so I'm a proud member of the Texas Farmers Union. I do a lot of work with international trade and a whole bunch of other good trouble causing. So I would say, and again, I'm coming at both the perspective of a producer and an organizer. Let me put it this way. In the 80s, 70s and 80s, for every $1 we would spend at a grocery store, we say you spend $1 on beef, I would get between 30 to 50 cents of that dollar. Anyone know what it is now? It's 7 to 8. Whoever, yep, there we go. And it ain't because food's getting cheaper. I think we all know that by going to a grocery store. To me, if I had a magic wand and I could change one thing, not to fix everything because there's no silver bullet here, but what would do the most good is to break up big ag, is to break up the monopolies that are crushing folks. They are crushing small farmers and ranchers because right now, 4 corporations control the meat industry, 2 of which, by the way, are not even American. One company controls 90% of our soy. We lose our soy, I mean, there's a problem. And even the chicken industry, one of the speakers was talking about innovation, and I love innovation. I think innovation is great. But for these chicken farmers, they can't, these corporations, they tell you when to feed them, what to feed them, how many hens do you keep, when do you turn the lights on, when do you clean. There's no innovation there. They actually do some innovation where they'll innovate on the farmers without telling them and drive them out of business. So that is my number one thing. And if you learn anything from me or remember anything from me, just remember we have to break up Big Ag.
I think one of the really interesting things of today, all the panels that we've heard, is that we hear this contrast between how effective policies are, how are they working, where do we find that tangible connection to it, and then you hear a lot from individual actors who are taking individual action. And so the next question I have is, to what extent should the government be involved in helping us create food policies? How realistic is it in terms of their outreach? And to what extent do we want to bolster and support local actors in being part of the bigger, maybe not bigger, but a big part of the solution to kind of addressing issues within our local community?
Well, you know, I'll tell you, to solve the problem, there has to be collaboration. It's very interesting hearing this panel because we could not represent this whole ecosystem anymore. So kudos to Bernie and Danny for the assembling here. I come from the perspective of what happens downstream, the individual, the person that ultimately their lived experience is a result of things upstream that they can't drive as much. What I find through that data, through listening to now 200,000 plus Americans share both, you know, evidence-based survey responses, but also we ask a simple question: how will a full cart box help you? And that's turned into a lived experience testimony. Some are short, some are 3 or 4 paragraphs. And so we're using technology to take both the quantitative and the qualitative and really align that with Z codes, which is just a part of the medical coding system that documents these social determinants of health, these things that these socioeconomic factors that impact insecurities overall. Why do we do that? Because we have to make that level of information actionable. As heartbreaking as a story is, it's not actionable. We can't integrate that into the work that FRAC and others do, right, to really drive change. So at the consumer end, I can tell you this, that what you think hunger is very different. 7 out of the 10 of the people that came to us last year, 73 people came, 1,000 people asked us for help last year. 7 out of 10 are employed, right? 7 out of 10 are employed. 8 out of 10 have health insurance. 40% of that number, it's private and commercial insurance. These are frontline workers sharing these stories. So hunger doesn't look like what it used to look like. And I think there is a silent group out there of working class Americans that won't go to a pantry, that won't go to a place to ask for help. And so we overcome a barrier that the system talks around but really doesn't address as often, which is shame, right? And so we're discreet and we're private. And so when I think about that, you know, and I look at, you know, kind of the top block codes that we see, number 1, 7 out of 10 is housing and economic insecurity. No surprise. Number 2, 15% of the time it is employment or unemployment. Number 3, it's environmental, social environment related things. Number 4 is education and literacy. And so, you know, I'm not the food guy on stage here. I'm the guy who's listening to people without food because of all of these other pressures. And so I think collaboratively, we need to bring together seamless, actionable data that's not imputed, right? It's not 10,000 people asked for food help, so food is an issue. It is 10,000 people shared their lived experience, and housing is an issue, and these other things are an issue. And I think until we connect that on our end, we won't really understand kind of the pressures that he is facing and what that's putting on people, right? And we need that kind of collaborative connection, and we need that kind of real data. That's, you know, I don't think we can really solve this until we understand and we have actionable intel on what's going on and how it's impacting America.
Rick, can I ask a quick follow-up question to that? So one of the things that I read about your organization is it really focuses on getting food to the individuals and then getting that data back from the individuals. Can you tell me a little bit about how you conceived that infrastructure and whether or not you feel like that's something that's scalable that can be applied to policy?
Oh man, I wish I could say I was brilliant. I wasn't. Pandemic happened. We had nothing else. We had to figure it out, to be quite honest with you. So we just started talking. Our pillars are dignity and discretion. You know the greatest form of dignity? Giving people voice. And we just start listening. We start listening, asking, and documenting what they would say in their own words. And so I think it is this platform that is discreet that enables us to have a real conversation, overcoming those barriers of worry and shame that come. Asking for help publicly is very public. And in this area of social determinants of health, you're talking about very intimate things that folks often feel like they failed at. Because I could not feed my kid, because I could not help my parents, because whatever it is. And so I think it's that platform of discretion. I think the other piece is we really try to think about how do we feed all. What we are learning in our model is that meeting people where they are, sometimes an emergency food benefit is more effective, than food for all at the moment. Because when you get to that point, you start to understand why they're here. And you'll realize the next intervention is most likely not food first, or it's a combination of food and. And I think we're not hearing the food and. And so if we don't hear the food and, we can't really, harness the power of food as medicine sustainably. And I think that's what we're learning.
Thank you.
Yeah. Going back, government has a tremendous role to play. And I think one of the interesting things, Clay, you were talking about in terms of thinking about things as a system, right? And hunger, when people are hungry, that means the system failed. The system's not working if people are hungry. And, it's an outrage that 44 million people in this country are in households where they don't know where their next meal is going to come from. 44 million. And during the pandemic, and even now, we're seeing black and brown families 2 to 3 times more food insecure than white households, 2 to 3 times. And during the pandemic, that was even higher. So when we think about this, and we think about the role government plays, for us, because we look at this all the time, it does kind of get our blood pressure up because we see these solutions in plain sight. We see some of the things that people talked about in the last panel. And it's important that everybody understands how these solutions play. SNAP is our first line of defense against hunger. It provides immediate nutrition assistance for families in need in the manner that's most culturally relevant and best appropriate for them. We also talked about school meals. We need to see healthy school meals for all provided for every school child in this country. We need that. We saw the benefits of that during the pandemic, and there's no reason we can't do that. They also talked about programs like WIC that are helping moms and their babies get critical nutrition assistance. And we spend a lot of time criticizing the government as advocates, but we also need to give props when props are due. So getting WIC fully funded this year, that was a big deal, and we should be very glad to see that happen. But we also want to make sure, and it was mentioned in the congressman's video remarks, to make sure that the program that was made available just after the White House conference, summer EBT, and he made reference to it. That is giving every school child that is on school meals access to food over the summer, because for a lot of these kids, summer is the hunger season. A lot of people think, oh, vacation, let's go play. A lot of kids, no, it's the hunger season because they're missing out on school meals. So Texas, we need you guys to join us on that. Yes.
And I just...
So, and other programs as well, like the child tax credit, super important. 2 top things people use child tax credit for: housing and food. So, super important.
And just a quick follow-up question. I want to be mindful of time, but I'm curious, how does your organization, I know we mentioned before coming up here that you've actually worked with some of the previous panelists, so how does the research that you do inform some of the policies that they are talking about?
So we share our policy with anybody, our research that anyone's going to hear, and sometimes even if they don't want to hear it, we'll share it with them. So, but we do that working with people at the federal level, folks like who were here before, folks at USDA, folks at some of the other agencies that are also realizing their important role in playing a part of this, and also our state and anti-hunger advocates across the country. So people right here like Feeding Texas, Every Texan, many of the food banks here that are doing great work to making sure that food assistance is available, because we know that for every one meal that food banks are providing, SNAP alone provides 9. So it is such an important thing for going back to the original point about the government's role. This cannot be completely outsourced to the charitable sector.
Thank you.
So we are going to need a combination of decentralization in the food system while also having some nationalization or national standards. So what do I mean by that? Well, this is going to surprise no one, as I already said it, but we need to break up these monopolies and get back to not corporate farming, but family and small producers. Whether that's farms, ranches, whether it's in rural areas or even urban areas. Urban farming is a growing trend, and we should encourage that growth. But some things are going to be, we're going to need national. You know, I've talked to a lot of folks, particularly my age, and they said, you know, I really want to get into farming, but I'm scared about not having health care. And yeah, I've had a horse break my arm. I've definitely gotten kicked by a couple animals, and ranching can be pretty rough. So we do need a national system like that. But we also need some national standards, because, I mean, they always say vote with your dollar. You know, that's how you vote with these things. But some of these corporations, they're getting so big they have become the market. So 2 case in point. Raise your hand if you or your child or someone in your family likes to eat a bowl of cereal in the morning. So decent amount, folks. So almost every cereal has glyphosates in them. That's Roundup. And the number 1 chemical to defrost milk is Windex. So every time you eat that bowl of cereal in the morning, you are eating Roundup and Windex. Here's another last example. Raise your hand if you like drinking tea. Keep your hand up if it's loose leaf tea or tea in a bag. So one company controls 90% of the tea bag industry. Every single one of those tea bags has bleach in it. That's why they're white. So again, some of these things we can't vote with our dollar on. We have to have a national system of national standards and tell them, hey, don't put Windex in my milk.
Thank you. So we are coming close to the end of our time. As all the previous panels, you each bring such a different perspective, and I wonder if you can share the different forms of call to action that you are each plugged into and just kind of help our audience understand where to go, where they feel called to help and support.
So I'd say go to ushunger.org and explore. We do a variety of things as it relates to the fight against hunger and food. I think if I could leave you with one call to action, I would say it is the way we have a conversation about the lived experience of the food insecure. What we find when we have now read 200,000 of those stories and hearing sometimes very heartbreaking things, we see heroism in that. I remember growing up poor thinking, well, you know, I didn't know that. I just didn't. All I remember was my family was together, and when I got older, I realized my mom was a hero. And so U.S. Hunger, the way we talk about the food insecure is through heroism and bravery. And we find that a lot of them coming to us are ashamed. And a lot of time it's because of how we talk about them. And we want them to be helped. We want them to reach out. We want them to engage. But if they feel ashamed about their current predicaments, I just encourage us to really reframe the conversation of the food insecure in language that is heroism, because many of them are in spite of, not because of, and they're making it. So that'd be my call to action.
2 quick words: speak and give. Speak, use your voice. You heard the story from Kellyanne last session about how Nebraska changed its course in getting summer EBT to its kids. It can be done, but it requires people to lift up their voice. And give. It is so important. I talked also about how a lot of folks look to the charitable sector. Well, we also have to look to the advocacy sector. Not just us nationally at FRAC, but also your state and local groups, whether they're anti-hunger groups or they're anti-poverty groups or they're housing groups. They all have a role to play. And sometimes as we, because we don't look at that this holistically, sometimes that important work gets overlooked. So these groups, they need your help, and they need it now.
So I would say 2 things. First, don't be afraid to call your member of Congress, your state house, your state rep, your senator, and tell them you want them to fight corporate consolidation. The rules are there. We have the Sherman Antitrust Act. We have the Clayton, which I love that name of that act, for some unknown reason. But we have the tools. They're just not being used. Now, granted, they're not complete. We still need to revise them. But the tools are there. We just have to, just pretend like you're taking a cattle prod and you're just trying to get them to do the fight for us. The last part is I would encourage join an organization that's dedicated to this. The reason I became a member of the Texas Farmers Union is because their number one thing is fighting corporate consolidation, fighting these monopolies, fighting big ag. I just actually yesterday got back from their policy meeting where we had to go through 227 pages of agriculture policy. So I now know a lot more about cotton policy than I ever thought I would know. But yeah, I would encourage join groups like that because there's power in numbers. And again, thank you all so much for being here. It's so incredibly important that y'all are here and that you take an interest in this. So thank y'all.
Thank you all so much for the work that you do. You are 3 heroes in the bunch that you were mentioning, and I'm really honored to have chatted with you today. Thank you.
Thank you. Thank you so much to our moderator and all of our panelists. Thank you so much.